taking care of your health and our veterans. Two of the big issues across the country and in Nebraska's 2nd Congressional District. Tonight, where Republican Lee Terry and Democrat Brad Ashford stand on those two issues in this Commitment 2014 report.
We are done.
Ever since President Obama signed the Affordable Care Act into law 4.5 years ago, there have been battles over it. And they continue in this year's congressional race between Lee Terry and Brad Ashford.
Well, I think you have to repeal it.
It's a big priority, but it's not going to be fixed by saying, let's repeal it.
Both Ashford and Terry say changes have to be made to the ACA.
Well, I think it has to be totally unwound and then rewound again.
Brad Ashford argues for a rewrite of the law, basically starting over.
I would look at the health care bill from the bottom up as if it didn't exist, and then try to build on the good pieces of it.
And says he would only support something that both Republicans and Democrats compromised on.
We need a bipartisan solution. And my quarrel with Lee Terry on this is very real. Voting to shut the government down or voting to repeal the ACA or threatening to shut the government down or whatever it is not the way to fix it.
Well, obviously, there's parts that are good parts of this bill.
While Lee Terry prefers it gone, he's voted for repealing it 4 times, he says the reality is it won't be.
There's dozens of things that we would agree on that would stay.
Like pre-existing conditions, children staying on parents' health care until 26. But one thing he says has to go is the so-called 30-hour rule, where once you work that long in a week, you can get full-time benefits.
The 30-hour rule is forcing employers to cut full-time employees down to 29 hours. So now we're becoming a part-time employment society.
The House passed a bill to push that back up to 40 hours a week, but the Senate has yet to vote on it. Health care for our veterans has been under fire, with delays at VA hospitals, reports of substandard care, mental health treatment lacking. They want to know what the candidates will do to help get Veterans Affairs back in order.
I think it's a long haul. I think it's going to take time to get it right. But we've wasted, well, 16 years, 15 years.
Ashford says the wars in Iraq and Afghanistan significantly increased the demand on the VA, and Congress didn't do a good job anticipating that.
So we're playing catch-up now.
His plan is to get the military, the VA, and Congress working together to make sure changes are made to help veterans.
That's what I'm constantly thinking about. How do we get these various agencies to work together? And it's something that has to be done.
Learning every day how to do it better. We're still working on it, but we're doing it a lot better.
Terry says Congress knew the wars would lead to a number of PTSD cases.
A lot of money was put into the programs at VAs. As it turned out, there was even more than we anticipated. We're trying to get the handle on those.
And he bristles at talk of things not being done on his watch. For example, he says the major issue for veterans here isn't the quality of care, it's the quality of the buildings. A VA hospital that he says would cost far more to remodel than to replace.
So that's why 10 years ago I got on the kick of pushing a new hospital and working with our delegation. We got it on the list and we keep pushing it.
Now, we posted all our stories about the candidates in this race and others on KETV.com. We also have exclusive content, including